They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. In our Frontline Diary segment today, we connect with Dr. Lindsey McMurray, an emergency medicine physician at the Ottawa Hospital. Dr. McMurray, good morning. Thanks for joining us.
Yeah, thanks for having me.
I understand when you came, when the pandemic hit, you had just come back to work from maternity leave, not too far behind that, before that. Tell us about how much that must have impacted things for your life.
Yeah, it was unexpected. I went back to work when my baby was 8 months old, and I think work was normal for a few weeks, and then the pandemic hit. So it was definitely a challenge. I think it's a challenge for any parent going back to work after maternity leave. But with the environment changing, what seemed like on a daily basis, there was a couple of extra obstacles to overcome.
Being in emergency medicine, though, I understand you just never really know what's coming through those doors, right? So did you feel somewhat prepared in the line of work you do?
Yeah, I think in some ways in the emergency department, we were lucky in the sense that we never know what's coming in, and part of our training is to really be prepared for anything. So I think we had a certain level of resiliency. To a certain extent, there are new things and nuances and differences about COVID-19 and how to care for these patients that we simply, couldn't be prepared from the very beginning. But to a certain extent, yes, we were, ready for the unknown.
I understand you were running some simulations as well. Can you tell us about that?
Yeah, so part of my work in the Emerge, in addition to my clinical work, is the director of faculty simulation. And what that means is essentially educating the other staff with high fidelity mannequins so that we can practice, and become proficient and competent. So what we've been doing with COVID-19 is doing some in situ simulations where we bring our fancy mannequin into the emergency department and get the team, by the bedside to practice these protocols, which are different than the normal, cardiac arrest and airway management that we're used to and that we've trained for over and over again. So it's a good opportunity just to, actually hands-on practice so that we're ready for when the real patients come through the door.
And when they did come through the door, were there any days or any moments for you that were particularly trying?
Yeah, I think for all of us, there's been days or patients that sit with us after the fact. But, I think it gives us some comfort knowing that we're prepared and we have done the best that we can do. But certainly with anything in emergency medicine, and specifically with COVID-19, there have been days that stick with you, unfortunately.
How do you think we're doing in the second wave now of this pandemic in our city? From your perspective as a physician in a hospital, how are we doing?
I think it's too soon to know, to be honest. I think that there are a lot of challenges with this second wave that weren't present for the first wave. Thinking about the long-term care outbreaks, the increasing hospital occupancy, there are extra challenges for us. It's heartening to see the community, coming together, everyone doing their part, wearing their masks, washing their hands. Obviously, it can be upsetting to look at the daily numbers of the cases increasing and increasing. But all we can do, I think, is be prepared and hope that we're, in the right place to manage whatever does come at us with the second wave.
On a personal front, when you would leave the ER and go home to your little baby, were there challenges with that, finding that balance because of the risk that you would be at being in your workplace to COVID-19?
Yeah, it was stressful at first, not knowing what type of a risk we posed to our families. We all have our, specific routines that we have when we come home, making sure that we don't bring anything home from the hospital. But it was really stressful, thinking that perhaps I'm putting my family at risk. The other thing that was stressful as well is trying to manage that balance to, be home when you're home and not bring your work home with you. And that was really a challenge at the beginning when things were changing every day in terms of new evidence, keeping up to date with what's happening in the rest of the world.
Mm-hmm.
I'm better at it now. When I come home from work, I'm home from work and I'm with my family, but that was an adjustment at the beginning for sure.
What would be your message before I let you go to the city right now to stay the course, to continue to follow all the guidelines we've been told? Because as many of us go about our lives, it's maybe easy for us to forget that there are people like you who are putting your lives on the line to protect those who are sick right now in our city. So what's your message to everybody?
Yeah, my message is stay strong, follow the protocols, wash your hands, wear your masks. And I think overall, be nice and be patient with those around you. Everyone is having a hard time in their own way.
Well said. Dr. Lindsey McMurray, an emergency room physician at the Ottawa Hospital. Thank you so much for everything you're doing for our city and for your time today.
Thank you.